So for the mobility assessment, what we're going to do is look at the entire body from head to toe and look at key areas of movement that we should have. This helps to provide information on whether or not you're getting movement where you're supposed to get them during meaningful movement patterns, such as walking, squatting, lunging, whatever it is that you're having pain with. So let's get started. When we record these tests, it's also important that you use the same angles that I use on my demonstrations so that your coach gets the best view of how you're moving. The more information and the more accurate the information is, the better our overall outcomes in plantar care is going to be. As far as setup before we get started, we want our men to be shirtless. We need to see their spines and their skin. And we also want our women to be in sports bras if possible. Shorter shorts for both so that we can see the knee clearly. And then we want to be barefoot. It's really important that your coach is able to see the contours of your body and get an accurate assessment of how you're actually moving and where you're moving, more importantly. The first test that we're going to do is the standing lumbopelvic flexion. Standing soft through the feet. You're going to bend over as far as you can and touch your toes. A camera angle that looks straight over the top of the back is ideal so that we can tell whether or not your pelvis is level or shifted. We're going to take the same view from the side. Next, we're going to do a backwards bend. Now a lumbar side bend, feet wider apart than the hips. You're going to bend out over the top of your foot and then compare it to the other side. Lumbar side glide. You're going to cross your arms over your chest. You're going to glide your pelvis to the left, keeping your shoulders parallel to the floor. And then to the other direction. Keeping your pelvis as still as you can, just rotate through the upper body. If you have a difficult time isolating this to the rib cage and the lower back, we can perform it in sitting instead. Sitting helps us to keep the hips from being involved. And then we can get a more accurate assessment of where that rotation is coming from. For our ankle lunge test, I've got a goniometer or a ruler next to the baseboard. And we're going to measure the maximum distance we can get the big toe from the baseboard with the heel staying down and the knee easily touching. You want to be very honest with yourself on how much mobility you actually have when we take that measurement. So that's about my limit. I'm going to score myself a 5 inches. Since this mirror is flush with the baseboard, I do not have to accommodate for any molding of the baseboard into our measurement. If your ankle gets restricted before you touch the wall, go ahead and scoot up. If your arch wants to collapse significantly to cheat and allow you to gain more motion, go ahead and scoot up. We want a nice, strict measurement, an honest measurement. The next test is the seated hip internal rotation test. So I'm going to sit back on this bench. I'm going to lightly squeeze a foam roller between my thighs. Some people like to use a yoga block. If you have wider hips and wider thighs, you may need to use a wider part of a yoga block so that your knees aren't adducting or squeezing too hard. Femur is nice and straight. From there, you're going to sit up tall through your pelvis, and then you're going to rotate your ankles outward and take note of what you feel and where you feel it. Pelvic positioning does influence hip rotation. So we're going to make sure that we are sitting up tall before you assess your hip rotation. You'll notice that I have more restricted rotation when my spine is upright and my pelvis is slightly tilted forward than if I slouch and rotate. However you decide to measure, just be consistent, because we're going to use this test over and over again for the future to determine progress. Next, we have our supine hip flexion test. Lying on your back, legs straight, place one hand underneath your lower back, and then you're going to flex your knee up towards your chest. You can also add overpressure without getting movement through your pelvis and your spine. And then we're going to compare that to the other side. We're just observing for range of motion quality and any negative sensations you might feel. For the figure 4 hip test, we're going to place one ankle on top of the left thigh, and then we're going to slowly drop our knee down towards the floor without rotating the pelvis. So we want to keep that pelvis and that rib cage as square as possible without allowing for compensatory movement. And then we'll compare to the other side. For our prone heel to butt test, we're going to lie on our stomach, grab the ankle, and pull it into our hip. And then we'll compare it to the other side. Next is our heel sit test. We're going to have our feet hip width apart, knees hip width apart, big toes are touching. And then we're simply just going to sit on top of our feet. A back view is helpful as well. Toes touching, ankles rolled outward. Sit on top of those heels. For our last test, this is the functional shoulder flexion test. I'm going to crisscross applesauce with my lower back against the wall. You can do this in a chair against the wall if that's more comfortable. You're going to keep one elbow and arm straight and attempt to touch the back of the wrist to the wall. Compare and repeat on the other side. A little stiff on that side. And then lastly, compare both sides at the same time. And those are our mobility tests.